China has admitted shortcomings and deficiencies in the country's response to the deadly coronavirus outbreak.
It says the National Emergency Management System has to improve, ordering a crackdown on wildlife markets where the virus emerged. The move comes after Beijing accused Washington of causing panic and spreading fear in its response to the disease, which was declared a public health emergency.
The virus has now been confirmed in more than 25 countries and territories, but international researchers are racing to develop a vaccine and halt the virus spread. Meanwhile, Hong Kong reported its first death from the coronavirus on Tuesday. It is the second death recorded outside China after the Philippines, as the death toll from the outbreak rose to at least 426 and over 20,000 cases globally.
All right. Joining us now is from Abuja is public health specialist and former staff of United Nations, Dr. Isaac Akuma Ebuja. It's nice to have you join us right now. When it comes to the issue of prevention, like they say prevention is better than cure, what should Nigeria be looking at now, both from the government side and even Nigerians themselves?
Well, from the point of view of the government, you know that the minister has been making announcements on radio and television, warning people and instructing us to what to do. The Nigerian Center for Disease Control is ready and is active. We hope that the virus does not come here, but if it does, I think that the government authorities are getting ready. In terms of individuals, we need to increase our personal hygiene, make sure that we sanitize our bodies, our hands in particular. And if you meet people who have just returned from some other country, be careful. If you have traveled and you've come back to Nigeria, be very careful, not only with yourself, but with those around you. If you have any symptoms that could be a case of this coronavirus, report it, don't hide it. There's nothing to fear. I will advise that people become conscious and attentive, but not to be panicky.
All right, the group of 7 countries, that's the G7, are looking at shared actions towards tackling this coronavirus epidemic at a global scale. They are looking at coming together to tackle this. Should African countries toe the same line to address this, even though there seems to be no case reported yet?
Why not? Yes, when we have this kind of case, it's not a case that is restricted to a particular country or to some countries. It is pandemic. And therefore, regional organizations like ECOWAS, for example, should team up, get ready, because if it comes to West Africa, you know how we travel from one country to the other as if it is from one part of town to the other. It will spread around very quickly. So regional bodies like the AU or ECOWAS, for that matter, as it relates to us here, should get ready, should team up, and should share information and expertise too.
All right, how closely related or different is coronavirus from the Ebola that ravaged parts of Africa in some time past? Well,
the closeness is the fact that both of them are caused by virus. But while Ebola is contagious, coronavirus is not as contagious as Ebola. And from the death rate so far, we have information that about 20,000 people have been infected, with 425 dead. That means 2.1%. If it was Ebola, we would have had a higher fatality rate. Also, the mode of transmission, the way Ebola spread with acute deaths, was much higher than what we are experiencing now.
All right, some countries are looking at developing vaccines already, putting monies together to see how they can tackle this head on. Do you think that we should also be looking at developing vaccines in this part of the country as well?
Of course, yes. Development of vaccines, drugs in general, is part of development and is part of industrialization. There's no reason why we should always sit down and watch others do things and wait until when they develop vaccines, when they develop drugs, we become recipients of those things that are produced elsewhere. We should, on our own, be doing what we should be doing, not only with regards to epidemic like we have now, but even on routine basis, vaccines that we use for immunization of children and pregnant women, we should produce them ourselves.
All right, China is able to develop or build over 1,000 capacity hospital within 10 days of construction as a way of meeting up with emergency. When it comes to taking a cue as to health infrastructure, what should Nigeria be looking at when it comes to investment to prevent cases like this?
First, they need to increase the health budget. I personally have been advocating for this for long. The amount of money allocated for health at the moment is far too small. It's about 4% of the national budget. We need to go 10% and above and be ready, set money aside for these kind of cases that are not expected or that you cannot predict. In terms of preparation, every state at the moment should have an isolated, dedicated hospital ready for cases. In the event that it comes here, states like Lagos, for example, Kano, and other states that receive a lot of people from other countries should have at least one health center, one hospital, dedicated, equipped, ready to receive patients in the event that it comes here.
All right, public health specialist and former staff of United Nations, Isaac Akuma Igboja, thank you for your time on TVC Breakfast.
Moving ahead now, China has admitted shortcomings and deficiencies in the country's response to the deadly coronavirus outbreak.
It says the National Emergency Management System has to improve, ordering a crackdown on wildlife markets where the virus emerged. The move comes after Beijing accused Washington of causing panic and spreading fear in its response to the disease, which was declared a public health emergency.
Now, the virus has now been confirmed in more than 25 countries and territories, but international researchers are racing to develop a vaccine and halt the virus spread.
Meanwhile, Hong Kong reported its first death from the coronavirus on Tuesday. It is the second death recorded outside China after the Philippines, as the death toll from the outbreak rose to at least 426 and over 20,000 cases globally.
All right, joining us now from our Abuja studio is Dr. Isaac Akuma Igboja, former chairman, National Veterinary Institute from Plateau State. It's nice to have you join us right now, Dr. Igboja. Now, the WHO has declared coronavirus a public health emergency of international concern. Now, we also know that there are about 60 Nigerians who are resident in Wuhan, where is the epicenter of the disease. How much of a risk are this to Nigeria? How much exposure is Nigeria to the coronavirus?
Well, when we have a problem like this, this is a pandemic in nature. And people who are exposed to the virus or people at risk, all Nigerians and other nationals who are in China and the Chinese themselves, everybody is at risk. The lesson or the instruction is that people should listen to the instructions of the health staff, health officials in China. They are doing whatever they can do to instruct people, to guide people, to direct people as to what to do to prevent themselves from being infected. So it is not only Nigerian nationals who are in China that are at risk. Everybody is at risk.
All right, we know that this coronavirus is zoonotic in nature, and China has ordered a crackdown on wildlife there. Should we be looking at this as part of our preparation in this country?
Well, yes and no. We have diseases similar to this in the country right now that we are confronting. Lassa fever is one of them. We've had yellow fever, and some years back we had Ebola. All these diseases have been brought to us through animals. We call them zoonotic diseases, meaning they affect both humans and animals. To say that because animals bring these diseases to us, we should have a general crackdown will not be practical. It is ideal, but it won't be practical. However, those animals that we know that are reservoirs for these diseases or these infections should be gotten rid of. Rats, for example, at the moment in Nigeria, is some animals that we are focusing on and advising people to do everything they can to kill, to drive, and to prevent rats from coming around them and around the food that they eat. Monkeys, people are very skeptical these days, and they have right to be skeptical. You recall that in 2014, when we had Ebola, the speculation and the message to everybody was that monkeys were responsible. Yellow fever, the same. So we need to be very careful in handling and dealing with wild animals generally.
Right.
And wherever we have a problem, they should be reported promptly. But in Nigeria, it will be very difficult, almost impossible, to say that we should declare war on all animals. By the way, it is not all animals, it is some wild animals. And each one that we know about, we will educate the public, we will let the public know that these are the animals that are responsible for particular or specific problems that we have. In this case, we will advise that all bush meats be avoided at the moment in the country. People need to stay away from bush meats, at least for now, until we are relatively sure that the mode and the means of preparing these bush meats are well controlled. For example, people go to the bush and find a dead animal. They carry it to the house, they butcher it, they cook it, they eat it, without knowing what killed the animal. And the fact that these animals harbor these viruses, these diseases, and can contact them through the animals is enough reason for us to avoid them.
All right.
So
we have to, due to time, we have to leave you here now. Dr. Isaac Igboja, thank you very much for talking to us on TVC Breakfast.